Vinny DeMarco, the president of the Maryland Citizens Health Initiative. The website is healthcareforall.com. Is not on the line with us. You're physically sitting right here with me.
And I thank you for the opportunity, Tom. I love to talk with you every year.
Thanks for joining us, Vinny. It's great to see you again. And we're at the Families USA Conference here in Washington, D.C. And so what's going on in Maryland? The Maryland Citizens Health Initiative has been rolled out. Tell us about this.
Well, we've been around since 1999 working to achieve quality, affordable health care for all Marylanders. And even before the Affordable Care Act, under the leadership of our Governor Martin O'Malley, Lieutenant Governor Anthony Brown, we have expanded health care to over 400,000 people. Mm-hmm. And that has really helped many Marylanders live.
Now, you did this before Obamacare?
Before the Affordable Care Act. And
how?
We did it partly with what I like to call public health revenue measures. Mm-hmm. These are measures that raise money, tobacco and alcohol taxes in particular, that not only raise money to help these programs happen, but also have independent public health benefits, reducing teen smoking, reducing underage drinking. Maryland has had, over the last few years, a 30% drop in smoking, overall 40% amongst teens.
How does that compare to the rest of the country?
Double.
Double the rest of the country?
Almost. The rest of the country is 19%.
Because the Fox News argument against that is, well, if you just raise those tobacco taxes, you're just going to create a black market on the border with the other states.
That happens very, very little. Mostly people quit or don't start.
Right.
And that saves lots of lives and saves money because smoking is one of the biggest causes of healthcare costs in our society.
If not the biggest.
If not the biggest. Yeah. And Maryland's been doing really well. Plus, it raises money, which has been used to expand healthcare for hundreds of thousands of people. And I need to tell you one story because what we did after that healthcare expansion happened is we did events around the state highlighting people who benefit, which your listeners can find at healthcareforall.com. Right. You go to Faces of Newly Insured, and you can see some of these stories. One I'll never forget is this woman who told us how she had been uninsured for a long time. Her husband worked full-time, but they couldn't afford it. Desperate. She took her kids into the local health department and said, "Can you help my kids at least?" And they said, "Yes, we can. But in addition, on this new law Governor O'Malley just signed, we can help you too." And they gave her a Medicaid card that she didn't have before. A few weeks later, she was feeling ill. Had she not had that card, Tom, she would have tried to sleep it off, as many uninsured people do. Right. Instead, she went to see a doctor. The doctor looked at her, examined her, and saw that she had this card and said, "Thank goodness you came here. You were developing something that would have killed you.
Wow.
If you didn't have this card, you would have been dead." She came to our press conference and said these words, "Thank you for saving my life." And that's the message to all the Marylanders who helped make that happen. But one thing I want your listeners to understand is that was not only life-saving for her and wonderful for her family, but good for the rest of her. Imagine if she had not had that card. She probably wouldn't have died right away. She would have gotten very ill, gone to the hospital, which would have had to have taken her under our laws, which we want, run up a huge bill, and then died. Could her husband have then picked up that tab? No.
Wiped him out.
We would have wiped him out, and then we would have had to pick up the rest. Right. Because there's what we call a hidden health care tax.
Right.
That hundreds of dollars of our insurance premiums every year go to pay for the health care of the uninsured.
Which ironically was pushed through during the Reagan administration by Republicans.
We need to...
That was that compassionate conservative thing. If you show up at a ER, they've got to take you.
They got to take you. Yeah. But what that means is we all pay the bill.
Right.
So let's pay the bill in a smart way.
Right.
Let's do it up front and keep people like this young woman healthy.
Yeah.
And in Maryland, we did it with tobacco and alcohol taxes, which was helped do that. Now, the Affordable Care Act, of course, took effect, and that's allowed Maryland to go a lot further. And like everywhere else in the country, we benefited from allowing young people under age 26 to stay under parents' health plan, which is, I know I've got a kid 23 and a kid 21, so I love this. In addition, seniors now get better breaks on their prescription drugs. Insurance companies can't charge too much, can't put too much of your money into non-healthcare related items,
right, like profits or golf faucets in the washrooms in the executive suite.
Nobody can deny somebody healthcare because of a pre-existing condition. That's a really big deal. All these benefits have happened, and since January 1, of course, the full Affordable Care Act's taken effect, and almost 2 million people across the country have benefited. In Maryland, another 180,000 plus people have benefited. Now, there have been problems. We all know there have been problems both nationally, my own state of Maryland with the website, but it's getting better. And these programs take a while to really work well. You remember George Bush's prescription drug bill to allow Medicare to cover prescription drugs. It was a disaster for a couple of years and finally got it going, so now it's working. We need to do the same thing here. get it working, and we're working on doing that.
Right.
In Maryland, over 160,000 people now have Medicaid who didn't have it before. Over 20,000 people have other health plans through private insurers. It's really good progress.
That's incredible. That's incredible. Maryland has taken the Medicaid expansion.
Yes,
and
it's really disgraceful for states not to do that. I just can't believe that a governor would be so callous and bad. It's bad for their whole economy to deny them all this money.
Border states with Maryland, Virginia. You share a large border with Virginia.
The new governor wants to do it.
Yeah, Bob McDonnell turned down that Medicare.
He did, but Medicaid. But the new governor, Governor McAuliffe, is committed to doing it.
Yeah. So it's going to be really interesting. Have you? It seems to me that, I mentioned earlier the conservative argument against raising tobacco taxes is that you're going to create this interstate black market. But it seems, following that same logic, that there might be some small amount of truth to that there would be a small amount of truth to the idea that if one state is offering Medicare and the other state isn't, people are going to talk.
Yeah.
That there's going to be people who are going to start getting outraged with like Rick Scott and Rick Perry, and they're going to say, wait a minute, this is not right. Why is it that somebody in this next state over? Now this is probably comfortable for the red states along the Gulf Coast that are all butted up against each other. They don't have a state next to them that has expanded, except the governor in Kentucky, is it?
Well, Kentucky's doing great.
He's making them squirm.
Kentucky is doing great. Kentucky's doing great on everything, both Medicaid and the website. They're doing great.
Yeah, and it's got the states around them just freaked out. I mean, Ohio, Indiana.
The people there are doing so much better. I mean,
Tennessee.
And Governor Kasich of Ohio, he got
He
Medicaid
took the money.
there,
That's right,
which is good.
Although he didn't do a website.
Well, but it's not a Republican or Democratic thing. It's just ridiculous for a state not to take the Medicaid expansion.
Yeah, it is, and really, it's a Republican governor saying to the taxpayers of their state, you paid federal taxes, and we're not going to allow that federal money to come back to our state.
Makes no sense.
No, it makes no sense at all. Vinny DeMarco, the president of the Maryland Citizens Health Initiative, their website, healthcareforall.com. Thank you, Vinny.
Thank you for having me.
It's great to have you with us.